I also want to give recognition to my director, Michelle Razor, who's out there. She's one of my directors from the School of Criminal and Social Justice, who thought it not robbery to take time out of her busy schedule to hear what I have to say on mental health. And to all of you, the Bethel Church family, thank you for this opportunity. And anyone else who's visiting out there, we're going to really unpack a lot of things. It's going to be uncomfortable conversations coming across this Zoom platform. And so brace yourselves for what is going to be said to God's people on for the next two sessions on mental health. Let me just say this, just a little bit more about myself for those of you who don't know me. I teach in the School of Criminal and Social Justice, and several classes that I wanted to mention that I do teach. I do teach addiction counseling and the individual. And I also teach substance abuse treatment, assessment, and planning. And the other course that I teach is cultural competence in human services. And I do also teach social welfare policy, and primarily to social students who are looking to go into the human services field of social work. So I just wanted to kind of share that little bit of more information about myself. And I also like to say this, we're not going to engage in any therapeutic approaches, just so everyone knows. We're not going to engage in any type of treatment. I'm not diagnosing anyone. The goal here is to share information, share general information, and also foundational information that you can build upon. Some of the information you've probably heard, but hearing it again helps it to really seep in so that you can use this information for what we've already come through, what we possibly could be going to go through in the future, just so that you understand that, again, the other thing I want to say is that we're not here to diagnose anyone with any mental conditions. The information is what it is, general information to help everyone to understand that your mind matters. So take some notes to self. And then I'd like to talk about some breaking stigmas through self-care techniques. And so all of this is about you and your mind, and it matters. Understand that, if I could, before I flip the chart, that a healthy body needs a healthy mind and spirit. Also, we have to be aware that your thoughts become your words. Okay, and I know, again, this is just foundational information that you know that I just want to build upon, but your thoughts actually do become your words. And your words turn into conversation, and then that conversation turns into action. And that action ultimately impacts your life. And then it impacts the lives of the people around you. So again, I want to just confirm what Dr. Williamson has already said, but we want to create a safe space for everyone to listen, to take notes, to share, to ask questions, not to be judgmental, to yourselves, to be judgmental on anyone else. It's a general information on about mental health. And so I was reading before, again, I flipped the chart. I was reading a 2021 study from the National Alliance of Mental Health. And the study reported that 47.6 million people, that's 1 in 5 Americans, 1 in 5 adult Americans experience mental illness yearly. That accounts for approximately 20% of teenagers from the ages of 13 to 18 coping with mental illness annually. The study went on to say that 18% of adults cope with anxiety disorder. And so this information that I want to share with you tonight confirms the importance of talking about mental illness, mental health on tonight over the next 2 sessions. Additionally, I was also reading a series of articles in the New York Times entitled "The Extra Stigma of Mental Health Illness in African Americans," and this was published in 2021. The publisher was Dana Gibbons, and one of the articles stated that between the disproportionate toll of the coronavirus on Blacks, Hispanic communities, the social unrest associated with what we've been going through, African Americans have now a new set of stresses, which further compounds the lack of access to mental health services in our communities. Also, it is important for us to note that African American communities, therapy is stigmatized as something for people who could not handle the challenges in some communities of color. Black people in particular fear that if they went to therapy, someone they know would see them and tell their family members and tell their friends. And so basically they hide in deep shame. Other cultures have taught us that we do not have the privilege of being vulnerable like other communities. And it has taught us that the only way we could find strength is in our faith. Okay. Historically, our history has shown that medical fields or the medical field cannot be trusted with our Black bodies. And just a little bit more about stigma. I'm going to go into it in detail, but harboring stigmas can negatively affect individuals. It can afflict them with mental health conditions. Stigma is identified as a strong feeling of disapproval that most people have about something, especially when that something is unfair. And a stigma can cause feelings of being an outcast to society. It could cause feelings of being an outcast to your communities. It can cause feelings of being an outcast to your family members. Stigmas can delay the process of coping with issues. It also can delay the process of even healing. Stigmas can actually exacerbate depression. It can increase the risk of suicidal ideation or suicidal thoughts. So support that we're going to be giving tonight is critical. It is a community support. It's a church family support. And also we have our family supports. And it's so important to open up conversations on mental health. So I thank you again for this opportunity to be able to do this. So let's move on real quickly. So your mind matters. And these are just some objectives that we're going to be going over. Now, we may not get to them. We probably won't get to all of these objectives tonight. And so again, I thank you for another opportunity to come back next week. We're going to be talking about what is mental health versus mental illness. We're going to be talking about healthy sadness versus depression, okay? How to discern symptoms in yourself or others. We're going to be talking about post-pandemic coping emotionally, mentally, and spiritually. And then I like to talk about essentials for mental health hygiene. I also like to say that some of the issues that was brought up last week will be incorporated in some of these things that we'll be talking about. We'll be talking about tips for managing mental health, COVID-19 aftermath. I have self-care worksheets. We'll be talking about how to help someone dealing with mental health. I also have an assignment. Actually, it is going to be an in-class, in-person, virtual exercise that we'll be doing. Maybe not tonight, but in our second session, I'd like to do an exercise. Very easy. I won't be asking you to be writing any papers or doing anything like that. If you want to take notes, you certainly can. We'll be talking about children and mental health. We'll be looking at tips for enjoying good health. And this little insight from midnight, I actually took that from actually a dynamic teaching series, preaching teaching series that I have been watching. And this is going to give us, it's going to take us into the scriptural or the spiritual perspective of mental health. And I'll be giving you foundational scriptures for recharging, refilling after ministry. And here is our group exercise: why consistency is key to mental health. And then what happens when, okay? And you're going to be thinking about and telling all of us, talking to all of us about what happens when we are not consistent, okay? And why consistency is the key that opens up the door for good mental health. And of course, I do have professional referrals and also resources. And I also would like to say that a lot of the information that I'm going to be sharing from you, general information, is coming from the MHA. The MHA is the Mental Health of America. And I actually, this is an excellent resource because this resource actually goes into resources. It goes into talking about mental health as it relates to African American community. And that particular resource, which is actually, it was embedded in the MHA, is called BIPOC, BIPOC. And that acronym then actually spells Black, Indigenous, and People of Color. So it's interesting for me to do comparative analysis to how European methods and therapeutic methods are similar and different from the mental health of African Americans, Indigenous, Hispanics, and Black and Brown people. So mental health is a critical part of overall health. So if you're feeling any distress, as Dr. Williams is saying, if you know anyone who's really stressed out right now, who's dealing with anxiety, text them, send them a text, say, come in. It's not too late to hear what the research talks about mental health as relates to, again, African Americans. And again, we may have some other cultures in here, but the comparative analysis really looks at the fact overall that some of the same symptoms that African Americans go through with, other cultures go through as well. So I just wanted to kind of share with you where this resource is coming from. And again, at the end of our session, our time together, I will share those resources if anyone wants to go in and look further into the resource. So there is hope. There is hope. So let's get into this. Let's dive into this. Let me just share this. The corona pandemic in the U.S. Has changed the daily lives of Americans. Okay, it has taken a toll on everyone's mental health. Everyone's, not only here in America but globally. It has caused stress and worry about contracting the virus. It has caused a loss of jobs, loss of childcare, the devastating loss of loved ones. It increased substance abuse. Transitioning from work to home was caused a lot of anxiety. And those who were required to go to work through the pandemic, it also caused a lot of anxiety for those people as well. The research says that 47% of adults continue to report to this day negative mental health impacts related to worry, related to stress from the pandemic. Nearly half of Black adults, or 49%, nearly 48% of white adults, and about 4 in 10 Hispanic adults, or 43%, say that the coronavirus has had a negative impact on their mental health. What are you saying, Dr. Patterson? What I want to say at this moment is that you're not alone. Even though a lot of us are still behind closed doors, we're still social distancing. Some of us are still in quarantine. The overall picture I want you to get right here is to understand that you're not alone. Okay, African-American adults in particular may be less likely to report any mental health difficulties and are more likely to face challenges when it comes to mental health care services. And so that's the reason why, another important reason why this conversation is so important. I want you to look at this and say it to yourself: what consumes your mind controls your life. And that's an anonymous writer on this one. Okay. What consumes your mind controls your life. Okay. So if you want to sit on the dock of the bay and watch the tides roll away, okay, life is going to pass you by. Okay. And what we're delivering tonight is that you don't have to sit on the dock of the bay and watch your life just roll away. Okay. So we're going to be talking about the things that consume your mind and how it can control your mind. And then, of course, I want to offer you some helpful tips that you don't have to let the negatives of life control your mind. So what is mental health? So mental health includes our emotional, our physical, and our social well-being. Okay, that's mental health. It's the well-being of our minds. It affects how we think. It affects how we feel, and our mental health affects how we act. It also helps to determine how we handle stress, relate to others. Mental health determines the choices we make, whether they're irrational choices, whether they're maladaptive choices, whether they're abnormal choices, or whether they are adaptive choices, rational choices, or whether they are healthy choices. Your mental health controls that. Okay? Mental health is important at every stage of life. Children are dealing with mental health as well. Okay? Adolescents going through adulthood are dealing with mental health. A lot of times we want to, especially in our culture, we want to just push children, say, oh, that's just the way they are. But we must, from this day forward, especially given the climate that we're coming out of and any climate that we may be going into, we must begin to take note on our children, our nieces, our nephews, and see that their mental health matters as well. And we'll be talking more about children as well. What is mental health? And what is mental disorder? The overall wellness of how you think, how you regulate your feelings, your behavior, overall wellness is your mental health. There's nothing abnormal, there's nothing crazy about the term mental health, okay? Sometimes people experience a significant disturbance in their mental functioning, okay? Significant key word, because a mental health disorder or a mental illness is something that happens frequently. It's ongoing, it's persistent, okay? And so just because you have one bad day, or maybe even one bad week, doesn't mean that you have a mental illness. A mental health disorder may be present when patterns or changes in thinking, feelings, or behaviors cause distress, disturbance, it disturbs or disruptions in a person's ability to function. A mental disorder may affect how well you maintain personal, family relationships. A mental health disorder may also affect how you function in social settings. It may affect how you function at your workplace with coworkers. It may function if you're in school. It may cause you not to get that paper done, or it may cause you not to log into the environment because you're dealing with a heaviness mentally that affects your schoolwork. A mental health disorder does not allow you to effectively or normally participate in important activities, maybe meetings, maybe you should be at a place where you were supposed to pick up your child and you were late. Maybe you didn't get to the daycare on time. And again, remember, a significant disturbance in mental functioning will cause a mental health disorder. What is mental illness? So mental illness, also called mental health disorders, refers to a wide range of mental conditions. Mental illness, if it gets to the point of a mental illness, and we'll be talking about some of the symptoms and signs, it is a combination or a multitude of various things that's affecting an individual mentally, which causes a disorder or a disturbance in their normal pattern. It's a disorder that affects your mood, it affects your thinking, it affects your behavior. A mental illness is not all the time verbal communication. Mental illness can be seen a lot in nonverbal communication. Nonverbal communication is silence. Nonverbal communication is something that you can see that's happening with an individual and they don't even have to speak words. Okay? Examples of mental illness include depression, anxiety disorder, schizophrenia, eating disorders, and addictive behaviors. And again, I'm going to be putting these terms so that you understand that it has to be something that's consistent, persistent. It has to be something that's ongoing. It has to be a significant change in your mental capacities in order for someone to label you with a mental illness. A lot of times we want to label someone with a mental illness, misdiagnosing or not even looking at the full overall picture of a person's mental health. So many people have mental health concerns from time to time, not necessarily a mental illness or a mental disorder. It could be just a mental concern. Millions of Americans have mental concerns because of what we all had to go through. That is not necessarily a mental illness, but a mental concern becomes a mental illness when ongoing signs and symptoms, again, here goes that word again, cause frequent stress and affects your ability to function, becomes a mental illness. A mental illness can make you miserable and could cause problems in your daily life, getting up, your domestic responsibilities, again, such as schoolwork and relationships. Mental illness occurs from the interaction, here we go, of multiple factors, multiple genes and other factors such as stress, abuse, and of course, traumatic events. And yes, the coronavirus was a traumatic event that we all had to undergo. But again, that can be more so of a mental concern and not a mental disorder. Let's look at some of the signs, okay, of signs and symptoms of mental illness, okay? Have you been feeling sad or down, okay? I think a lot of us have, especially if you had to go it alone in your apartment, haven't been able to get out, or when you go out, you rush back in. So, you know, this feeling of sadness and downness is a sign and it's a symptom, but it's not necessarily a mental illness unless it's a continuous pattern. Okay? Are you confused in your thinking or reduced ability to concentrate? And has that been happening over the course of a period of time? Are you dealing with excessive fears or worries or extreme? Okay, there's another word for mental illness, extreme feeling of guilt. So much so that you can't move forward in your daily activities. Do you have extreme mood changes, highs and lows? Do you have withdrawal from friends, activities? You just don't want to be bothered anymore. Don't want to go out with anyone. You just want to stay home. Okay. Are you experiencing significant tiredness, low energy, or problems with sleeping? Okay, now let me just stop right there. I think all of us, well, maybe not you, but I've actually been experiencing problems with sleeping. And I attribute that to what we've had to go through. If you're not getting out, if you're not getting the exercise you used to get. I mean, I used to go from sun up to sundown. By the time I got home, I was ready to transition, do what I need to do, cook the dinner, and I just wanted to go to bed. Now I seem to be able to wake up all the time. I have all this energy. That's not necessarily mental illness. Okay, detachment from reality, delusions, paranoia, hallucinations. All of these are signs and symptoms of what could be a mental illness. Okay, and I say what could be again because it has to be a significant amount of time that you've been dealing with these particular signs and symptoms. Do you have trouble understanding and relating to situations, to people? Do you have trouble concentrating? Do you have trouble focusing on what someone is saying? Do you find yourself drifting off when someone is talking to you? Okay. Do you have problems with alcohol or substance abuse? Okay. Problems meaning that it is in excess. Okay. Major changes in eating habits, sex drive changes, excessive anger, hostility or violence, suicidal ideation, once again, thinking. And so again, when we talk about these particular symptoms, are they in excess? Is it happening every day? These are just some types of mental illness that I just wanted to show you. And there's anxiety disorder, bipolar disorder, sleep-wake disorder. I'm trying to drive home this idea that mental conditions vary and different from mental health. Okay. Obsessive compulsive disorder. Are you the perfectionist? And if things get out of order, you just blow a gasket or you blow a fuse. Okay, that's obsessive compulsive disorder. Are you controlling? Are you obsessively controlling over your husband or over your wife, over your children? Okay. Are you having an eating disorder? And again, we've all had the corona weight on us. But you have to be mindful on that. And everyone who's eating because you're home, you're eating a lot, doesn't mean that, oh, now I've developed this eating disorder. You have to be mindful of what you're eating, how you're eating it, and remember to get the exercise behind eating. But it doesn't necessarily mean that you have a mental illness because now you're home all the time or not, or you are. Some of us are home all the time and we're just eating. As soon as we finish doing one thing, we go back to eating again. We have this, what some call a nervous kind of eating. And again, a lot of it is due to what we've had to go through over the past 24 months. Depressive disorders, and overall, all of these types of mental illness, if you could take a look, what I'm trying to show you is the fact that all of this are people who have a significant mental illness. It's an extreme. It's something that's continuous. It's something they can't control without medication. Let's move on quickly. So how is mental health different? How is mental health different from mental illness? Okay, mental health is your general state of well-being and state of mind. Okay, something that you really should look after, something that you really should take care of every day. Just as you get up, you take care of your hygiene, your physical hygiene every day, your mental health hygiene has to be taken care of and it has to be looked after every day. Mental illness is something that disrupts your mental state and interrupts how you feel. It interrupts how you think, and it interrupts how you communicate, and it also interrupts how you behave. Mental illness just like mental health, has to be looked at every day. If a person has a mental illness, every day you wake up in the morning, you're dealing with someone who has a mental illness, and sometimes depending on your physician, there may be some type of medication that has been prescribed, and that person has to take that medication. It has gone to that extreme where that person may now be on medication. Of course, when we talk about mental illness, we can look at various scenarios of people who did not take their medication. They were mentally ill. Of course, we know that the pandemic caused a lot of agencies, healthcare agencies, substance abuse agencies to close down. And a lot of people could not get the services, the needed services that they were supposed to get. If a mental illness is not looked after, taken care of, we have things like the man who had a mental illness who pushed the 40-year-old Asian lady into the train station, onto the train. She lost her life. He was suffering with a mental illness because it was not taken care of. And so many other issues. The man who decides that he wants to just shoot down homeless people. Just going around from town to town, just taking a gun and kicking them while they're sleeping, shooting them down. There's something wrong with that. There's a mental illness. Okay. If someone who has a mental illness is not taking care of themselves, we have things like Sandy Hook, where you had the person who had Asperger's disease to go in and kill 26 administrators and children. Okay. So if someone has a mental illness, according to the studies, that has to be taken care of every day. Okay. Mental health, again, has to be taken care of every day. So there's some comparisons here where the same thing, mental health, mental illness, it should be looked after. Something we have to look after every day. We can't allow our mental health to lie dormant. Otherwise, other thoughts start to creep in, okay, and could lead to some type of mental condition. Let's look at stigma. Okay, we had talked about it earlier. So let's look at this. Okay, I want to move on a little bit. So I want to get through some of these charts and start talking about other things. Stigma is, again, when someone views you in a negative way because you have a distinguishing characteristic, some type of personal trait that's thought to be a disadvantage or disability, a negative type stereotype is a stigma overall. A stigma, when we talk about stigmas can lead to discrimination. And I did some work on stigma, and this stigma is a big word when it comes to mental health right now in our society. Stigma tends to be a huge word. And there are advocates right now who don't think that stigma is the correct word or the correct context of mental health. And there are some who are advocating that we take this word out when it comes to mental health. So now what we have, I did some research on this whole idea of what's happening with stigma. And we actually have stigma campaigns going on, and their focus is raising awareness to remove individuals who are blaming stigma for mental health disorders. And basically these advocacy groups are increasing help and seeking behaviors. And so basically what they're trying to do is to advocate that this whole idea of stigma is in fact, should be in the context of a mental health condition. And this is what they're advocating for. So stigmas can lead to discrimination when it comes to marginalized populations. Discrimination may be obvious and directed, and again, such as individuals making a negative remark about your mental health illness, individuals making remarks about the fact that you're going to counseling or you're seeing a therapist, or individuals making remarks that you're taking some type of medication, that could develop a stigma when it comes to mental health. There are other stigmas, but I'm just trying to keep it narrowed down to mental health. Other judgments also always stem from a lack of understanding and a lack of information about you. And they judge you not based on facts, but based on some type of conspiracy theories. They judge you based on someone else's conversations about you. And all of this can create a stigma, which from my perspective, can lead to a mental health issue. And so I'm trying to correlate why we have those who are trying to advocate that this is not a word in the context of mental health, because the stigma to me clearly says that the individual's thinking capacity has been disrupted by some negative connotation, by someone sharing information not based on facts. It's based on hearsay, based on what the conversation they've heard, or based on some cultural perspectives that they did not get information clearly on, which is causing someone to develop this particular stigma. So learning to accept your condition and recognize what you need to do to treat it is important. Seeking help is important, and helping others, helping to educate others is also important and could make a big difference when we try to help others who are dealing with stigma. Okay. Here are some of the harmful effects of stigma. Okay. When you have a stigma, it's a person who has a stigma is reluctant to seek help because they don't think that they need it. They're reluctant to seek treatment because of the deep shame that we talked about earlier that they're experiencing. Okay, there's a lack of understanding by family and friends, coworkers, and others, which again compounds the stigma. Okay. There are no opportunities or few opportunities to advance in work, school, or social activities. People with stigma have trouble finding homes. They have trouble, talking with others, social engagement, social interaction. They have trouble doing that because of the stigma that has been placed upon them. Causes bullying, physical violence, and of course, harassment. And there's case after case we could talk about where individuals are dealing with stigma. We live in a very diverse society. We live in a multicultural, multiracial society. And a lot of people are dealing with stigma, which is causing them to just isolate. It's causing them to not even want to come and deal with the public because the stigma that they're dealing with is so heavy. They're so impacted by stigma. It actually is hindering them from normal interactions with family, with friends, and of course with social networks. It's a terrible way to live when you're stigmatized. And again, all of this comes from your mental capacity. It certainly isn't physical, but when your mental capacity has been impacted by some form of discrimination or some form of negative connotation or some stereotype, if your mental capacity is not strong, it can cause you to isolate. Okay, and so we want to talk about some things that can help that. So the belief that you'll never succeed, all of these things, your challenge or you can't improve your situation. So the stigma that has been put on an individual, not only causing them to isolate, but causing their mental capacities now to think more maladaptive, more abnormal, and more pessimistic than optimistic for the individual who is dealing with the stigma. Okay, let's go on. Okay, So I wanted to talk here about steps to coping with the stigma. Okay. I think everybody can see me. To see if I can move this a little bit. Okay, there we go. Okay, so the first thing is to get treatment. Okay, if you're dealing with the stigma, you may be reluctant or admit that you need treatment, but you need to get some treatment. Don't let the fear of being labeled or someone labeling you with a mental illness prevent you from seeking help. Okay? Treatment can provide relief for identifying what is wrong. Treatment can reduce the symptoms that interfere with your personal life, and treatment can also reduce the symptoms that interfere with you going to work, the symptoms of dealing with your children. Don't let stigma create self-doubt and shame. Okay? Stigma doesn't just come from others. You may mistakenly believe that your condition is a sign of personal weakness, or you should be able to control yourself without help. But seeking counseling, educating yourselves about your condition, and connecting with others have actually helped to strengthen individuals who are dealing with stigma. It has actually helped to strengthen their mental health. So to isolate only causes more and more negative thoughts to go through your mind. You can't reach out, you can't touch it. You have to push over that and try to get some help. Don't isolate yourself. If you have a mental illness, you may be reluctant to tell anybody about it. Okay. You may be reluctant to tell your family members. You may be reluctant to tell your pastor or your friends or members in your community. But these are the people that can help you. They are people that can support you. You got to be able to reach out to people you trust for the compassion and for the support and for the understanding that you need. Don't equate yourself with your illness. You're not an illness. Okay, so instead of saying I'm bipolar, or saying I have a bipolar disorder, instead of speaking those words into the atmosphere, instead of calling yourself a schizophrenic, say I am going to get better. I'm going to get help. I'm going to get over this. And actually speak those words from your mind. Remember, we talked about what's in your mind becomes your words, and the words become conversation, turns into action. Okay. And the action becomes, impacts you, it impacts others. Join a virtual group. That might be a stretch for some, but join a virtual. Actually, the research says join a group. I actually put virtual in there because this is where we are in our society. And if you're dealing with this type of stigma, discrimination, or whatever, self-doubt, whatever shame you're dealing with, a virtual group could probably help, because you don't have to leave your home. You could be there in your home, and you could be in the group, and possibly that can help to build more confidence and self-esteem to get you out. Okay, if you're in school, if I have any students out there, which I don't, Dr. Reyes, I did not invite the students. I know there'll be a conflict of interest. But if any of you are in school, there are support teams at school. I know where I work, we have 2 psychologists on staff who work full-time to support our students who are dealing with stigmas in mental health. Speak out against it. Okay? Be a part of an advocacy group. For instance, the advocacy group I just spoke about that wants to remove stigmas from the context of mental health. And we have people that say, oh no, that is a part of mental health. Stigma is a part of mental health. Join the advocacy group. In other words, join those who are dealing with the same type of stigma, or who are dealing with stigmas as yourself. It's a support mechanism that can tell you you're not alone, but there are others who are dealing with something similar. Let me just see what time I have. Okay, let me just see if I can get another chart in. Let me see if I can get just one more in. I'm going to turn this back over to Dr. Williamson. So let's look at this. Let's start this one, and then I think I'll turn it back over to Dr. Williamson. Let's look at depression and the signs and symptoms of depression. And again, I talked about this earlier, that due to cultural backgrounds, depression may be exhibited differently among African Americans as opposed to European Americans and other cultures. And so when I did my comparative analysis on this, I did actually find that the same type of signs and symptoms of depression in African Americans is similar to European Americans, Latinas, Hispanics, Americans, Asian Americans. And I said, well, why? I wonder why. Well, because we're all human beings. We all bleed the same. We all have two eyes. We have a nose. We have a mouth. And so just to get into my cultural competence teaching, I don't understand when we talk about mental health, some of the same things that are happening in other cultures are similar to what's happening in African American cultures. So why are we having such disproportionality from a cultural perspective, and the impact of it disproportionately impacts our society when it comes to mental health services? Okay, we all have persistent sadness, anxiety, emptiness, mood swings, excessive crying. Okay, and again, these are symptoms that are persistent, they are continuous, they are significant changes in your mental state. Reduced appetite, weight loss, increased appetite and weight gain. Again, with COVID and people being at home, some people call it COVID weight. COVID weight don't necessarily mean that it's a symptom of depression. Persistent physical symptoms that do not respond to treatment, such as headaches, digestive disorders, chronic pain. If you know anyone who's dealing with this on a persistent basis, it's a sign, and it could be a symptom of depression. Irritability, restlessness, decreased energy, fatigue, feeling low, slow down, just don't feel like doing anything. If this has been happening to you over the course of a few days, you're not depressed. It could be an anxiety as a result of what we're going through. I know when I heard that there's a new variant out there called BA2, I'm waiting to hear what Dr. Fauci has to say about it, and now how this new variant is going to affect Americans. Okay, right now they don't know. And so people, worthlessness, helplessness, hopelessness, pessimism. If you're consistently talking negative, oh, I can't do it, that's not going to happen. If you're consistently finding yourself not talking positive thoughts, not feeding your mental capacity with optimism, feeding yourself with good things, good thoughts, you could be on the road to symptoms of depression. Sleeping too much or sleeping too little, early morning waking. So again, overall, these symptoms have probably happened to some of us. Some of us have probably had headaches or digestive orders, some chronic pain or some mood swings. It doesn't necessarily mean that you're depressed. It could be a sign, it could be a symptom of depression if it is persistent. Loss of interest or pleasure in activities, including sex. If you're losing interest in pleasurable activities, a lot of this is because of the anxiety that all of us have had to go through. Hoping that this endemic that we're in now can bring us back to some semblance of normalcy. Difficulty concentrating, remembering, making decisions, thoughts of death or suicidal ideation or suicidal attempts. All of these are found in our cultural background, and all of these can be signs or symptoms of depression. And I think I want to start right there, Dr. Williamson.